Bismillahirrahmanirrahim. Assalamu alaikum. This is me Nazir Ahmad from Pakistan. Today our topic of discussion is mechanism of drug absorption. If you are new on my channel, please subscribe to my YouTube channel and press the bell icon button so that you may not miss any upcoming video. Mechanism of drug absorption. Depending on the chemical properties, drugs may be absorbed from the gastrointestinal tract by passive diffusion, facilitated diffusion, active transport, or endocytosis. Passive diffusion. The movement of drug from a region of high concentration to one of the lower concentration without a carrier involvement, which is not saturable and shows a low structural specificity, is called passive diffusion. The driving force for passive absorption of a drug is the concentration gradient across a membrane separating two body compartments. The vast majority of drugs gain access to the body by this mechanism. Water-soluble drugs penetrate the cell membrane through aqueous channels or pores, whereas lipid-soluble drugs readily move across most biologic membranes due to their solubility in the membrane lipid bilayers. Facilitated diffusion. Drugs can enter the cell through specialized transmembrane carrier proteins that facilitate the passage of large molecules. These carrier proteins undergo conformational changes, allowing the passage of drugs or endogenous molecules into the interior of cells and moving them from an area of high concentration to an area of low concentration. This process is known as facilitated diffusion. It does not require energy, can be saturated, and may be inhibited by compounds that compete for the carrier. Active transport. Energy dependent active transport is driven by the hydrolysis of adenosine triphosphate, which is capable of moving drugs against a concentration gradient from a region of low drug concentration to one of higher drug concentration is called active transport. This mode of drug entry also involves specific carrier proteins that span the membrane. A few drugs that closely resemble the structure of naturally occurring metabolites are actively transported across cell membranes using these specific carrier proteins. Endocytosis and exocytosis. These types of drug delivery systems transport drugs of exceptionally large size across the cell membrane. Endocytosis involves engulfment of a drug molecule by the cell membrane and transport into the cell by pinching of the drug-filled vesicle. Exocytosis is the reverse of endocytosis and is used by cells to secrete many substances by a similar vesicle formation process. Vitamin B12 is transported across the gut wall by endocytosis, whereas certain neurotransmitters, for example, norepinephrine, are stored in intracellular membrane-bound vesicles in the nerve terminal and are released by exocytosis. Thank you for watching my presentation. If you have any question, please write in the comment section below.